How would a parent know that maybe it's time to bring their child to play therapy or to try?
Those pretend scenarios are tied to their real experiences. Emotion is safe, the full range of emotion is safe, and we can explore that together.
So play therapy allows them to try on things without distress.
Yeah.
And it sounds like kids maybe even do this naturally in their own way when they play.
Yeah. When a child is presented with a solution to the problem that is right in front of them, they're very much more likely to internalize that and use that as a skill in the future. The parents are a huge part of this process. My work can't be done without them. With kids, it's a little tricky because so few children will come up to you as a parent and say, I need therapy. That's the type of pain that we see come to counseling in a very dire state. And they could have been helped so much earlier.
Well, it's so great to be sitting with you here. Would you introduce yourself and what you do at New Ground?
Yeah, my name is Jaimee Velotta, and I am a play therapist here at New Ground, specifically at the Snohomish Child Therapy Clinic. And I see kids from ages 3 to 12, and we do play therapy together.
I think people are maybe wondering, do kids really need therapy? Isn't therapy for adults? Why do kids need therapy?
Yeah, I think people probably are really wondering that. I think the way that I frame it is that therapy with children, for one thing, is extremely different than therapy with an adult. I think when you're thinking about, when like adults are thinking about therapy, they're imagining two people sitting across from each other for 50 minutes and diving deeply into like all of these deep concerns and like talking for that full hour. And then you are looking at a child and imagining that they absolutely are not going to be doing that. And that's true. They absolutely are not going to be doing that. It's very different. And that's why I do play therapy instead of talk therapy. Because what children absolutely can do is process their world, their internal and external experiences through the language that they're most comfortable in using, which is play. And directly to the question of whether or not they need it, I think children, as all humans, experience pain and the brokenness of the world. They experience internal turmoil. They have traumatic experience happen around them. And just as with adults, they greatly benefit from having a safe third space with a safe adult to process and to work through those things and experience growth. It just looks really different than it might look with an adult.
Well, I would love to hear about play therapy specifically. What is play therapy? What is unique about play therapy that makes it different from other forms of counseling?
Yeah, that is a great question. I think that's one of the first things that I talk about with families is what exactly play therapy is, because I think you can read that word or those two words, play therapy, and come to a lot of different conclusions. And a lot of the time you would be correct. There might be some counselor somewhere that does it that way. There's lots of different ways to do play therapy. And so my answer will be what I do, which is kind of a combination of a couple of different, what we call modalities. So the primary thing that I follow is called child-centered play therapy, which is based in a couple of different things. It meshes some things together, but the basis is that you are following the child's lead. That means that this space is going to be very unique for them because they are going to be in charge of everything within safety guidelines. So we keep ourselves safe, we keep the space safe, but outside of that, they get to choose. They get to choose the rules, they get to choose the activities that we do, and they get to choose whether or not we clean up. That's a big deal for them, and I think one of the most fun things and liberating things, that they can just move from thing to thing without having to tidy it up away first. And we can do all of that because play therapy is based in the research behind play and the value that play holds for children and how they use the medium of play to communicate and process. What is unique about play therapy versus other forms of child therapy is that as the play therapist, I follow the child's lead and integrate coping skills and growth activities and poignant books and social emotional learning and all of that. I integrate that interspersed in their process. I am the adult in the room. I am looking for opportunities to integrate that. And I'm looking for opportunities because when they present a problem, either talk about something that they're going through or there's a problem in the play itself, I can then offer this coping skill as a solution. And when a child is presented with a solution to the problem that is right in front of them, they're very much more likely to internalize that and use that as a skill in the future. There are lots of other modalities where you kind of have a structure of what you're going to introduce when, and that works for some counselors and it works for some kids. I have a background in Montessori teaching, and so that informs my love for child-centered play therapy that follows the lead of the child and integrates skills as they show curiosity and readiness for those things. And I've seen huge success in presenting skills in that way, even skills that have been presented before. They've heard about deep breathing. They've heard about mindfulness. They've heard about conflict resolution or how to calm their bodies, but they haven't integrated it. They haven't used it in their life. And the play therapy space offers a really unique scenario where we're creating almost very much pretend scenarios that have conflict, that are, those pretend scenarios are tied to their real experiences. And so when we have this externalized, sort of, it's not them, but it's similar to something that they've experienced, and then I model or provide a coping skill, they can then integrate it right away, and they're still calm and regulated, so their regulated body can integrate that coping skill really well. Versus a sort of a dysregulated body where they're dysregulated and you're trying to introduce a coping skill and they don't do it because their brain can't do it in that moment. And so that's, I think, something that's really, all of those things are really special to play therapy, and specifically the type of play therapy I do.
So play therapy allows them to try on things without distress.
Yeah.
And it sounds like kids maybe even do this naturally in their own way when they play.
Yeah, absolutely. That's what the research has shown is it's remarkable how much children process on their own, given the right circumstances, given the safe environment, given a safe person for them to co-regulate with. They will do this process on their own, and having a safe anchor as a therapist allows them to explore even more intensity than they may on their own, and explore it in a way that is even more beneficial because there's an adult in the room putting the pieces together of, I know your story, I know how this ties to your story, and I have a bigger toolbox than them, and I can introduce things as they come up. And I also have a fully developed brain that can stay emotionally regulated. And so while they explore intensities of emotion, I can help them, I can follow them up to the intensity and help both of us come back down and experience that emotion is safe, the full range of emotion is safe, and we can explore that together.
That just makes me wonder, how are parents engaged in your process? What role do they play in all of this?
Yeah. The therapy I do is individual with the child, but the parents are very much involved in the process. There's a rhythm to my therapy, and we begin with a parent intake, a meeting between myself and the parents or parent or caregiver. And then I do 4 to 6 sessions with the child, and then I do another parent check-in. And that's the same throughout the whole therapeutic process. Is 4 to 6 sessions with the child, and then a parent check-in. And those parent check-ins are really key for everyone involved. That's where I share what's happening in the therapy space, what themes I'm noticing, any questions that I might have, any recommendations I have based on what I've seen. And it's when I hear what's going on at home. It's when we're brainstorming different types of interventions. It's very much more the quantitative, like data-based element of my care. How frequently are these things happening? How intense are they? I'm getting more metrics on like sort of how things are going, and we're tracking the progress throughout the therapeutic journey with the family. They are involved in the beginning and then every month along the way. And if ever there were need to be more communication, I'm accessible over email, and so we can make more meetings. They can join for the beginning of a session or the end. Kids are always welcome to invite their parents in to have guided conversations. So as I've said, I am a team member with the parents and the child, and that definitely means that the parents are a huge part of this process. My work can't be done without them.
Okay, now that we know what play therapy is, how these concepts play out maybe with children, how would a parent know that maybe it's time to bring their child to play therapy or to try this out?
Yeah, with kids it's a little tricky because so few children will come up to you as a parent and say, I need therapy. It's more common now. Maybe they have friends or know what therapy is, especially if they're getting older. If they're like 12, maybe they will ask. But most likely they won't. Most likely you as the parent are making that decision for them. And outside of things like for you just need help. Like as I said, as a parent, you might just have tried so many things and this thing is still distressing for your child, or it's still disruptive for your family. They still haven't gotten past it. There are indicators like in a child themselves, in their behaviors, that we as therapists see as indicators for internal or external distress. And a lot of those are behavioral, so sleep regression or disruption in sleep, and we're looking for big changes. So if they've never slept very well, that's one thing, but if they did sleep really well and now they aren't, that would be a disruption in sleep, a disruption in eating habits, either eating a lot more, eating a lot less, hiding food. Any of those things could be indicators. And then disruption or regression in toileting, so bedwetting or daytime accidents, and an increase in those would be an indicator that something might be going on. And then a huge change in school performance, so like a grade or 2 change in a short period of time at school, big behavioral changes, so they might have one temperament and then they all of a sudden change either to be very withdrawn or very explosive. Any big change, and obviously kids change really rapidly, and so these aren't necessarily, we're not looking for like the small sort of gradual changes that kids go through. And in puberty it's even harder because that is a time of huge change, and so some of these things might happen, and it may be very developmentally appropriate, but I think parents have a really attuned gut instinct about these things, and that they would know their child and think like this is not normal for them. And when a lot of those things add up, in addition to big life changes, you also want to look at that. Like, has something significantly changed for them? Have they lost one or more family members? Have there been conflict or disruption in the family or in the home? Have they moved a lot? Have they had to move schools? Has there been a lot of friendship disruption or change? Sort of a constellation of things could be happening. And as a parent, you're looking at all of these things and then looking at your child and thinking like, do I have the resources to handle this on my own, or do I need some additional resources?
Yeah, so how can parents explain what this is to their children or even prepare them to come in for their first time?
Yeah. I like to describe play therapy or therapy as a safe place to think and talk about hard things. And that might be language that a parent could use. Parents will know their children best. And if they need more information or less information, then I think a parent will know that. But that's how I describe it to the child when we have our first session. That's what this is. A lot of the time, children don't know what therapy is or don't know what counseling is. And so they might be very nervous for their first time. They don't know who I am. They don't know what to expect in the space. So parents can also sort of describe what will go on and what this space is. So they'll walk up a flight of stairs and they'll wait in a waiting room. There'll be snacks and toys, and then the therapy door will open and they'll all as a family come get a tour of the space. They'll get to see all the things, and then they get to choose where the family waits. Do they wait in? They stay in there with the child, or do they wait in the waiting room? And every child is different. Some really want to keep a parent with them or a sibling. Some want them out and they want to just play. And a parent can explain, like, there's going to be lots of toys in there. There's going to be lots of things to do. And you're not going to have to talk about anything you're not comfortable with. And you're going to be in charge. You're going to get to play with someone named Miss Jaimee. I always, in my first parent meeting, recommend that they tell their child that they've met me, that they trust me, that I'm a safe person, so that their child feels a little bit more trusting and safe with me.
So some of those indicators for therapy are probably really clear, like you mentioned, really maybe bigger behaviors or things parents would see. Is there any indicators that a child might need therapy, but maybe a parent wouldn't see?
Yeah, there's actually sort of a whole category of children who often get missed in care. And when we're thinking about, it actually draws back to regulation and dysregulation. When our brain is flipped and our emergency center is taking over, it has these three options: fight, flight, and then freeze. And freeze is the most overlooked because it's a withdrawing and a silence and a turning in on oneself. And that can often be misunderstood for shyness, or that's just how they are, they're quiet. And sometimes that's the case, but if this is a shift for a child, or you see even more withdrawing than maybe is usual, that would be a warning sign. So kids that tend towards this freeze response will tend towards the side of dysregulation that tends towards depression or suicidal ideation or self-harm or self-loathing. That it's sort of like where the kids who have big behaviors, their pain is extending outward. The kids that are withdrawing, their pain is turning in on themselves. And indicators for that are a little harder to pick up on. They're more withdrawing into their rooms. They're more no longer engaging. And it's a kind of a lack of things, where some indicators are a more. This is a lack. It's a disengaging with things that they may have liked before, whether that be hobbies or friends or activities or school, and this might also be something that other people have a different perspective on. So teachers, friends, parents. And and it's internal, so you can't see it. So it also requires a certain level of communication with your child about how they see themselves. So noticing the kind of language they're using about themselves. If they're using an increase in like self-deprecation and like negative self-talk. If they change dramatically in how they dress, if they're just looking like they want to shrink and hide. It's a quieter pain, but it is a very real pain that can really benefit from counseling early on, because that's the type of pain that we see come to counseling in a very dire state. And they could have been helped so much earlier.
Yeah, so if someone was interested or curious or intrigued, how might they, what's available to them to get started?
Yeah, the very first thing that would be available would be a 15-minute phone consultation where we could ask some quick questions and talk. There's also a full intake session available where we would talk even in more detail and about what exactly brings them to seek care. Either way, I'm excited to meet them and to talk with them about their families and their specific concerns. And yeah, I'm excited to get started.